Acute respiratory failure, that happens when you have problems with your exchange of O2 or your CO2. It's not a disease, it's a condition. There's usually some underlying lung condition that's affecting your ability to adequately exchange gases. It's either hypoxemic, which means you've got an issue with your O2 exchange, or it's hypercapnic, which means you've got an issue with being able to get rid of your CO2, so you've got too much CO2. Manifestations, so you're going to have rapid breathing, you're going to have a respiratory rate that's higher than normal, and it's usually very shallow. You may have a respiratory rate that's slower than normal. Either which, a rapid shallow rate, or a slower than normal rate, both of those can result in an inadequate exchange of CO2 and O2. So they may have an increased work of breathing. They may tripod, and that's when they're like leaning forward. They're basically trying to increase the anterior posterior diameter of their chest to try to make it easier to breathe. They may have the pursed lip breathing. They may have retractions, which is when stuff goes in that should not go in, so you can like see in between their ribs. They may have the inability to speak complete sentences. This is what you'll see sometimes in your asthmatic patients. So the same kind of thing. They may have to breathe after every word. That's not a good sign. So people who can't speak in complete sentences, we're concerned about, and they may also have some paradoxical breathing just because of the lung diaphragm issues that they may be having. How do you treat acute respiratory failure? Oxygen. You give them oxygen. You do things to help mobilize the secretions. You get them up, you have them move around, you have them increase their PO fluid intake, and then you may have to give them bronchodilators to open up their airways, especially if they're wheezing. Steroids, because it's going to decrease, steroids decrease all the inflammation, so you may need some steroids. If the fluid is built up in their lungs, you may need Lasix to get rid of the fluid. Antibiotics if it's due to an infection. Morphine if they're if they're in pain, to kind of help decrease the pain, to help them improve their gas exchange and breathe better. And then if they're really, really anxious, we'll do something like some Ativan to kind of help them not be so anxious. Again, if you can't breathe, you're anxious because that's very stressful to your body. So you're a little anxious, so sometimes if we give them a little Ativan, it kind of decreases their anxiety and actually helps them to breathe just a little bit better. So that's what you're going to do for acute respiratory failure.